Assalamualaikum doctors. In this video I am discussing about procedure consent taking scenario, that is about fundoplications. Look the picture, normal stomach and the stomach wrapping after fundoplication. This is the picture we draw in these communications. Okay, the task comes like that: a 2 year cerebral palsy, CP with GERD, not responding to treatment. So consultant taken that need to do fundoplications. As usual, we do with our IRCAP. So this is why our consultant asked us to talk with you, hopefully to take a consent called fundoplications. Did you heard about it before? No, doctor. What is that? Okay, can you please follow me at this drawing to make myself clear? Okay. So we draw a picture. This is our food tube and this is our stomach. Actually, Ali is throwing up because he has loose valve here between the food tube and the stomach. What are planning to do under the effect of the sleeping medicine? This is done by open surgery or keyhole surgery. We'll wrap the upper part of the stomach around the lower end of the food tube and fixed it tightly with sutures to tighten this valve and prevent the regurgitations. Okay. So what? This is the food tube, this is stomach. The connection between the stomach and the food tube, this is loosened. That's why food regurgitation occurs. That's why we are wrapping by a specialized surgery. It's maybe open surgery or keyhole surgery. Okay. But let me first tell you about the drawbacks of this procedure. There is a risk of sleeping medicine, but it is given by an expert doctor. Also, there is risk of pain, but painkiller will be given through the procedure. And afterward, are you with me? And also, adding that to this, there is a minimal risk of bleeding, but it is done by expert doctors who have done it hundreds of times. Also, there is a negligible risk of catching bugs, but it is done in a complete septic conditions. Am I clear? So we will tell the drawbacks of all procedure and also how can we the complication is we solving. First of all, sleeping medicine side effects can be occur, but expert doctor are doing one. Another one, there can be minimal bleeding occur. Again, expert doctor, and you will monitor, follow up, observe, and also there is a for a catching bug, but we are doing very hygienic septic measures we will take. These are adding that also there is another complications, and also the body will take time to adapt the new shape of the stomach. So there is maybe temporary floating or some gagging. Adding to this, some sutures with the time will be untied, and that time we may need to repeat the procedure again. Am I making myself clear? Again, we tell that also there is a new shape of the stomach. So body has to be new shape of the stomach. There is some bloating, gagging. This problem can be temporarily occur. Also, sometimes the suture can be untightened. That time the procedure can be need to repeat this procedure again. Am I making myself clear? Okay, doctor. But is there is any alternative? Actually, the alternative is the medication which is already not working. Second alternative, a tube from the nose to stomach, which is not best options. Am I clear? So alternative are first of all oral medication which is not working. Another is a tube will put through the nose to stomach, but this is not the best options. Okay, I'll think about it. Okay, thank you for your time. But sooner is better. Okay, then summary: trusted website, written leaflets, support good as usual we tell. Thank you.